Tonight, the island's chief medical officer says there is no need for panic as there has been swift action at the OKEU hospital following the confirmation of COVID cases among staff. The St. Lucia Medical and Dental Association cautions against sensationalizing news of physicians contracting COVID-19. And the Prime Minister says St. Lucians must learn to coexist with COVID-19 as a shutdown is not an option at this point. The details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Tuesday, the 27th of October, 2020. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. 3 individuals linked to the Owen King EU Hospital have tested positive for COVID-19. A memo informing staff of the development has been making the rounds on social media. While our team was unable to get a comment from the executive director of the hospital, the president of the St. Lucia Medical and Dental Association says there is no reason for the public to panic, nor is there any reason to sensationalize the news of medical professionals contracting the virus. Genevieve Gonzague begins our reporting.
A memo is making the rounds on social media from the OKEU hospital, asking staff to note that at least 3 members have tested positive for COVID-19. The memo also informed that other team members were in isolation as well as quarantine for the next 2 weeks, and that 3 outpatient clinics, namely gynecology, orthopedics, and anesthesiology, have been suspended for the next 2 weeks. It also notes that the administrative department scaled down its operations. While the Hot 7 team was unable to get a comment from the executive director of the Owen King EU Hospital as of press time, the president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, has spoken out on the matter, including allegations that the cases were kept concealed while the information of other individuals were made public.
What this tells us, certainly, in part, is that nobody is exempt, and it should be a reminder that we all need to stick to protocol. The idea that everything needs to be sensationalized is unfortunate. The comparison being made that information was hidden about this as opposed to the bus driver is ludicrous. Bottom line is, if a physician tests positive, you know who the physician saw. These are issues that are documented, so it makes contact tracing, in a sense, it's a wide process, but you at least know exactly who you have to contact, as opposed to a bus driver where you have no idea who got on the bus, because certainly nobody gives the names when you get on the bus.
Dr. Clark says the leaking of internal memos on the part of professionals is absolutely unnecessary. However, she notes that the contact tracing efforts have proved very effective, and as such, this should engender some sort of confidence in the system.
It would be naive of us to have expected never to get any more cases of COVID-19. Our aim has to be able to contain and to mitigate, but we all have to do our part. We have the infrastructure in place for the most part. We have the testing capacity, but everybody needs to do your part. If you are unwell, seek care at a respiratory hospital. Ensure you're wearing your masks in public and wearing them well, that your mouth and nose are covered. Social gatherings right now should be limited to just your family. Just let's try to do what we need to do, and as a nation, we're going to get through this.
Dr. Clark has once again called for the end to stigmatization surrounding COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
Meanwhile, the SLMDA has addressed a leaked letter to the CMO which contains recommendations by the association.
We, the executive and members of the St. Lucia Medical and Dental Association, would like to emphatically denounce the leaking of private correspondence, which was intended for our Chief Medical Officer, Dr. Sharon Delmar George, who is a long-standing and esteemed member of the organization. As has been stated on numerous occasions, we implicitly trust her ability to provide guidance on policy decisions pertinent to public health. Such abhorrent actions serve only to undermine public trust in our systems as we all continue to fight this invisible enemy, which is waging war on both lives and livelihoods. End quote. A response was received from the Office of the Chief Medical Officer requesting a meeting on Tuesday. Unfortunately, the SLMDA says the avalanche of calls and messages regarding the leaked letter interrupted meeting preparations. Reporting for Hot 7 News, I am Janine Tenga.
Now, as you heard in our previous report, 3 of the 9 COVID cases confirmed on Monday, the 26th of October, are staff at the Owen King AU Hospital, 2 of them being physicians. The situation has caused much public concern, but the island's Chief Medical Officer, Dr. Sharon Belmar-George, says there is no need for panic as the situation is very much under control. By all accounts, there has been rapid response to the confirmation of COVID-19 cases. On Monday, it was confirmed that 2 physicians and a member of the administrative staff at the hospital had tested positive for the virus. Chief Medical Officer Dr. Sharon Belmar-George says a scenario where hospital staff test positive for COVID-19 was anticipated and planned for as part of COVID-19 response contingency plans.
The hospital, they've in a very proactive way, from the time the contact tracing was done and even before the confirmation of those cases, they did put a plan together to see how they would quarantine those persons who need to be and to provide services to the public, because as you would imagine, this is our main public hospital. So in a very proactive way, they've looked at how they would recruit staff from other public facilities, also part-time staff, to ensure that emergencies are dealt with and services, which for some of the outpatient clinics are being provided within our community services.
The CMO spoke to the process of contact tracing, where 119 tests have been conducted among hospital staff thus far.
We had 1 more positive which was detected within the hospital. So we anticipate that after the period of quarantine and retesting, we would gradually go back to normal. It also gave the hospital the opportunity to review their protocols and their policies to ensure adherence at every level within the hospital setting. So it is something which we've prepared for. We anticipated, especially the hospital is seen as a high-risk institution. So it is one of the eventualities that we did anticipate would happen at some point.
Outpatient services at the Owen King AU Hospital have been suspended for the next 14 days, and only emergency surgeries will be performed. Stay with us. Still to come, the Prime Minister doubles down on statements that a shutdown is not an option at this time. Health officials confirm that Grosley and Castries have recorded the most COVID-19 cases so far, and tourism workers at the same hotel property contract COVID-19, but health authorities say they likely did not get infected at their place of work. That and more after the break.